Okay, so I'm going to move into System 1 now, just to start showing you what we have in Ardens relating to cancer. I'm starting in a screen called Clinical Reporting because I want to show you some of the reports that we've got. And I've gone into Clinical Reporting and to the Ardens Limited folder and then the best practice, and there's a subcategory in there called Cancer. So you can see there are 4, 5, 6 maybe reports relating specifically to cancer. There's one looking at whether any patients at your practice have platelets recorded at below 450, but then there's also some preventative reports looking at people who have missed screening. So we've got bowel cancer screening due, breast cancer screening for certain age ranges, so 47 to 73, and then there's some for cancer, cervical cancer, screening as well. And what you can do is just highlight the reports and run them in the normal way, and then that will return the patient count. Just on the right-hand side of these reports, you can see that there's a red exclamation mark, and what that means in the patient's record is there's an alert associated with that. So I'm going to bring up my patient. And then show you that alert in the top right-hand corner. Just there, it says cervical cancer screening is overdue. So I can actually just click straight into that. And then that takes me into a screen. There's a little bit of information on here in the cease and defer page, but just on the front page for a second, there is a section where I can, if somebody has been DNAing their cervical screening appointments, is I can highlight the text and email reminders to say that we've been informed that they've DNA'd. I can copy that, and then I can open up SMS or email and contact the patient to let them know that we're aware of that, and hopefully they can book their appointment. And then the little bit of information I was referring to up at the top, cease or defer, we've got information in there to say what ceasing is or what deferring is, and then there's a link to Open Exeter. So you can open that, update the information for a particular patient, and if for any reason you can't use Open Exeter, then we have forms directly below that for you to fill in. Just back on the screening page, there is a link to be able to record a cervical smear. I'm going to come out of that and just go in a slightly different way. I'm going to go into my F12 where I've saved my smear template. So should the patient come in then for their smear, I'm going to open this and go into the procedure page. And then in here there's different things. I can record that I've given them a leaflet and then click on the link on the side. To print that leaflet out, I can update that consent for smear has been recorded, and there is a consent form if you wish to use it. You can print that at the bottom, get them to fill it in, sign it, and then you can scan it back in if you wish to as well. Any advice that's given, STIs and domestic violence advice, preconception, or advice about breast exam as well. And then just here next to the red star is always QOF in Ardens. If I drop down that picking list, then I can record I've taken the smear. And things like reason, is it a recall, routine call, was it done under GMS, so on and so forth. There's some chaperone information that can be added as well. And then you've got, if I jump to the bottom, a link to Open Exeter again, and then a follow-up advice section here. So did I give them advice that they should hear within 2 to 4 weeks, what to do if they don't hear, and have I given advice about normal, abnormal, inadequate results, etc. What happens then once I've recorded that is the smear then sits in cervical screening waiting for the result to come back, and someone can just add that by right-clicking and add results. So that's fairly straightforward. Just in terms of other types of consultation where you might be recording cancer information, we've got the blue medical bag, and I'm just going to illustrate a breast cancer lump, or a lump, I should say. So I've opened the blue bag and gone into the breast consultation page. There's space at the top there for free texting history and exam, but what we do on Ardens is we quite often put presets in. So just on the right-hand side, I've got a button where I can add in one or more presets if that's appropriate to do so. I can put in some information about my exam once I've examined the patient, but we've also got the breast diagram. So if I want to record where the lump is, I can just click there to illustrate. And then other bits of information that would be useful for a breast consultation is who's chaperoned, or perhaps chaperone was refused, nobody was available. And then if I jump down to diagnosis, I've got a list of read codes here, so it's just for me to select what's relevant. I'm going to choose breast lumps there. I can select other codes by using the red R, the read code button on the right-hand side as well. We also include referral criteria just to help. So at the very bottom of the page here, if I click on the orange arrow, I can open up referral criteria about 2-week weights, abscess, asymmetry, genetics perhaps, and those are all criteria that are read-coded. So for example, somebody who has a first-degree female relative diagnosed with breast cancer who was below 40, if I tick that box, at the bottom then, I can say that the criteria has been met and I'm going to do a referral now. So I'm just going to press OK. OK again. That's my breast consultation done about a lump. Below the patient's name, there's lots of icons. The orange arrow will let me open up all the referral forms. So in the 2-week weight section, and then breast. And then click on Right Now. Okay, good. So my form's opened, and what you will see is everything that I've recorded since I've opened my patient. So some of this might not be relevant. So I can edit the form. Some of it that will be relevant, I can leave that in there. And then I can quickly fill in anything else that's relevant. And if I scroll further down, I can see my medical drawing showing where the breast lump is for that patient. So just in terms of whatever the local processes are, people usually save the form and then send a task for the form to be sent by 2-week wait. Now further down the line, if the patient does find out that they have breast cancer, that will need adding as a read code into the patient's record. So we do have lots of cancer templates. In the auto consultation menu, we have a category called Ardens Consultations, and you'll see all of them labelled alphabetically, and the icon for each one is the blue CC. So if I were to open up the breast cancer template from here and then drop this menu down where it says New Diagnosis, I can add the appropriate read code. As it happens, the patient that I'm working on now for the webinar today has had a read code added already, which is why below their name they have the blue CC. So the quickest way for me to then access their breast cancer template going forward, just by clicking up there along the top. I'm going to go straight into a button called Cancer Care Review. And within that, I'm just going to show you some of the sections in here. So The red star at the top, that's indicating QOF, and so by ticking the box, I've then done my cancer review for that patient. There are different sections below, empty boxes that you can type into. Again, we've got presets, that's quite common in Arden, so things like understanding of diagnosis. And then just on the right-hand side, if I'm happy with the presets that are in here, understands diagnosis, prognosis and curative intent of treatment. Otherwise, I can just type in what suits. Treatment side effects, again, just look in the presets, is there anything in there? Do they have side effects or perhaps no side effects, no complications, no side effects overall? Any signs of recurrence, psychological or social issues, and also concerns and expectations there as well. There are some scored assessments, so there's mood and anxiety scoring as well, if that's appropriate. And then right at the bottom, we've got leaflets again. So if I open up that one, you can see as I scroll through the labels on the left, we've got different types of leaflets, cancer leaflets, bladder, bone, got the breast cancer ones here. And the idea really is that you either just click the link to access the leaflet that you want, or a little bit like what we did earlier on with the DNA, the smear DNA. Oh, I can't seem to highlight that. Yay. And then I can press Control-C on the keyboard. It does tell you at the bottom. Open up email or SMS and then paste that link in so somebody can open it on their phone. Also things like care team and care and relationships generally. So if I click this button here, it shows me who's involved with their care, if anybody is, but also I can assign carer information if that's relevant. So if they have a carer, I can select that, and then down the side here I can specifically add details of who that might be. So it might be a sibling or a parent, guardian, spouse, for example, and then I'd click through who the spouse is, husband, and then start recording those details, type in their first name and surname, and add any contact information at the bottom. Then, just going back to the top of the cancer care review where we ticked to say we've done the review, there is a button there called Cancer Treatment Summary. So this is just a way of recording what treatment they're having or how it's going really. So things like read codes for chemotherapy, there's hormone therapy, radiotherapy, also genetics advised, genetics counselling, and each one of these boxes has a date field on the right-hand side, so you can date that accordingly as well. And then just here we've got the treatment picking list, so is it curative treatment, is it palliative care perhaps, just assigning the relevant read code to the patient there. And then just moving on to another template is the end of life one. So I've just pressed F12 to open up my shortcuts, which I attached there just to show you that we do have end of life palliative care stuff on here as well, ticking to say that an MDT review has been completed if that's appropriate, and adding who was present during that, and then also any notes from the meeting. But then jumping straight to the bottom, there's a red triangle here called Future Care Planning, and if I just slide my template out of the way, you can see in the background below the patient's name there's a red triangle. That's the same as the Future Care Planning button here. So it's a quick way below the patient's name of getting to this information, like special notes, what's their resuscitation status, what's the treatment escalation plan, etc. So either by clicking below the patient's name or going through the way I have, you can see that information and then add new by clicking on any of the buttons directly above. Got key messages here, So I can free text new key messages in, and again, there's presets. So we've got things like maybe it's end-stage cancer, frail, at risk of falls, anything that's relevant. Excuse me. And then the treatment escalation plan itself. So that's assigning resuscitation status along the top with a read code, and then either free texting or using presets to say what the plan is. So the plan might be full treatment, or maybe fluids, for example, antibiotics, but maybe not artificial feeding. And then things to do with the prognosis, who's aware really. We've got prognosis levels in here, third-party awareness. What are the plans for death? Is there a preferred place? Funeral plan, organ donation, and then at the bottom we've got decisions and mental capacity. And there is a button on the right-hand side for more information on that. And then finally, just on this template, the end-of-life formulary. So this is where all the medications are. We've set it up so there's lots of links in the left-hand side for information, BNF, CKS, Wessex Green Book, palliative care guidance, etc. And then we've got the starting doses at the top, the just in case and syringe driver, and then further doses just below that. So if I click onto just in case, for example, and just pick a couple of prescriptions. And at the very bottom, we've got the community drug chart. So if I click that one, and then each area has a localized form. So this is what the form looks like for Wiltshire, but the medication will populate onto the form, and then it can be printed off and signed and used at the patient's home. Okay, I think that's it from me. Does anybody have any questions that they'd like to ask? It looks like I think we've got, so we've got a question here regarding the leaflet. Can that be emailed rather than printed? So you've answered your own question there, but yes, all leaflets, we always have launch email or launch SMS as an option to be able to paste into those to use instead of printing, really, yeah. Okay, any other questions from anybody? Okay, I think that might be it then. Thank you very much, everybody, for joining. Thanks, bye.